Okay, I think we are ready to go. Thank you so much, everybody, for taking time out of your busy schedule to join us today. We're really excited to be here with you to talk a little bit about the importance of fostering peer-to-peer mental health and share several ways that you can do so. My name is Simone Figueroa, and I am the president of You Thrive Educational Services, an organization that provides mental and emotional wellness programs for college students to help them manage stress, become more resilient, and thrive throughout their undergraduate experiences and beyond. Our programs are rooted in the fields of positive psychology, mindfulness, and self-compassion, and they are designed by over 35 leading experts in these fields from various institutions across the country. And I will turn it over to my colleague Becky to introduce herself and share a little bit about Active Minds.
Yeah, thank you so much, Simone. My name is Becky Fine. I'm the Director of Training and Engagement with Active Minds. So Active Minds is one of the nation's leading nonprofits working to change the culture around mental health among the next generation. So we really work to meet young adults where they're at. So that's going to be in high schools, college campuses, and communities and workplaces. So we were founded about 17 years ago now, and have really kind of developed to respond to where the conversation around mental health is kind of at every given moment, which has changed a lot over the last 17 years. So we're really proud to be able to adapt and be agile to kind of what's happening in the current research, what's happening, what's the current need of young adults, and then create partnerships and programs and content that is responsive to those needs kind of in the real moment.
Thanks, Becky. And I'm really excited to share that You Thrive and Active Minds have recently partnered together to offer our new peer-to-peer wellness curriculum, which is designed specifically to empower and prepare college and university students with the skills needed to start the conversation around mental health and create change in their community. And this is something that is really near and dear to my heart. I struggled with my mental health as an undergraduate student, and I so deeply wish that there were organizations like Active Minds on my campus, and that my campus was taking the initiative to create a community that destigmatized mental health and really allowed for peer-to-peer conversations so that I can hear that I'm not alone. And that's something we'll talk a little bit about. But I know that this is something really near and dear to my heart. And it's one of the main reasons that we partnered together with Active Minds to bring this kind of curriculum to students. So Becky, I don't know if there's anything else that you want to share about our partnership, or just in general, if there's anything that I missed before we kind of dive into today.
I can just kind of reiterate that we're excited as well. It's the first opportunity we've had to connect up with an organization that was working with evidence-based curriculum like You Thrive does. And so to have the opportunity to adapt that to meet the needs of the audience that we work with has been really wonderful.
Awesome. And so we really want to keep today very informal and conversational. So please feel free to utilize the chat. We will be monitoring it and kind of conversing with you as we go. We don't need to wait till the end. We do have some time allocated to Q&A, but we really just want to come together, have a conversation, and so feel free to use the chat. And before we really dive into talking specifically about peer-to-peer support, I think it's important just to set the tone and just briefly touch on the mental health crisis on college campuses, which I'm sure everybody is aware of. I mean, there's no shortage of alarming statistics indicating that students ages 18 to 24 are really struggling with their mental health. In fact, 1/3 of college students worldwide, not just in the United States, experience a mental health crisis during their first year on campus. And according to an Active Minds survey that was conducted in 2020, 80% of respondents reported that COVID-19 exacerbated mental health issues. And this, of course, comes as no surprise. And a survey that was conducted by the American Council on Education reported that 70% of college presidents identified student mental health as a pressing concern. And I think this is really, a positive news, because COVID really has shown a spotlight on the need to provide greater support for student mental health, and the recognition by even presidents that this is something that we really need to focus on is a real step in the right direction. And there are many, many different ways to support student mental health. It's really imperative that we take a campus-wide, multi-pronged approach. And so today we want to kind of really just focus on one prong of that multi-pronged approach and discuss peer-to-peer support. So Becky, why do you think higher education institutions should incorporate a peer-to-peer approach to supporting student mental health in their mental health initiatives?
Yeah. Well, I think one thing at Active Minds that we really emphasize is, like you said, we see a third of young adults are experiencing or struggling with their mental health. But what we also know is that all of us have mental health, and all of us kind of have ups and downs with it. And that all really matters. And changing the culture around mental health is what's going to help to prevent those ups and downs from hitting crisis point in a lot of cases. And so I think that's really, really important. So the reason why we think peer-to-peer and peer-based support is so critical is because we all know that it's our peers that are going to who are the culture changers, right? It's like it's one thing, it's very important to be creating, like you said, multi-pronged, very important to be working on policy change that are supportive and creating a climate and an atmosphere that is supportive of mental health. So that's one layer. Certainly having buy-in from administration and faculty and staff, and talking about that in classes and in orientations and all of those things, critical steps. But the people who are really going to have the power to truly change the culture are peers. And so being able to empower and support peers to have the tools that they need to change the culture and the community and the conversation among each other is, I think, the most powerful vehicle that we have to kind of changing the way that we're treating and talking about mental health. And so I think that's why it's so critical to be responsive to what young adults need right now, what they say what they report they need, and bringing stakeholders to the table. So, it's Active Minds really adheres to the kind of nothing about us without us method. Is sort of, we're seeking to serve young adults, and there's nothing that we can do or decide without having young adults at the table to tell us what exactly is needed and how we can be most effective with our work. So, in addition to kind of all of those pieces, we know that the research bears that out. We know that the research demonstrates that people who are struggling are most likely to tell a peer before anyone else. And so in addition to kind of the culture change side of things, we want to really make sure that peers know how to respond to each other and know how to find resources and support each other in getting there, changing their behaviors or impacting behavior so that young adults are confident in saying, you know what, yes, if somebody tells me that they're struggling, or if I'm struggling, I know where to go, and I'm willing to take that step and to support somebody in taking that step. So that's kind of where we're at right now with it, I think. And I could talk a bit about stigma and perceived stigma and all of that if we want to go there. But yeah, that's kind of my nutshell.
Thank you for sharing. I think it's so critical that, the research supports that peers and students are more inclined to telling their peers as the first kind of line of defense that, hey, something's not right, that I'm really struggling. And I think that in and of itself is such a important piece of why institutions should really pay attention and focus on this peer-to-peer support and equipping students with skills not to solve, their peers' mental health problems, but making sure that everyone is kind of equipped with like, how do you, identify and where do you direct someone that maybe has vocalized those, or how do you even create spaces where students can openly talk about some of their struggles, kind of how I shared with my own struggles. It would have been nice to hear that, hey, I'm not alone in this, and this is actually quite common. And so I think that is a really profound piece of evidence that, making sure that we're not missing that peer-to-peer component when we're thinking globally about how do we address student mental health on campuses.
Yeah, absolutely. And I think another really compelling piece of data that we've come upon several years ago, the Rand Corporation did a study among colleges in California, and it included community colleges, CSU, California State University, and the University of California. So 3 different systems there. And it just demonstrated that on campuses where students perceive support of mental health, they were 22% more likely to seek help when they needed it. Like just a massive, significant jump in the ability to seek help. And so then, of course, the big question is, what does it mean for a campus to be perceived as supportive of mental health? And so that's another layer of the study that's forthcoming. But when we think about that, it's multi-pronged, like you said. It's policies coming from the top that suggest supportive leave of absence policies, crisis lines on your student ID cards, those kinds of, and then support of student groups like Active Minds and curriculum that supports mental health. So getting it into syllabi, getting this curriculum into classrooms. So there's just a lot of layers to that. Mostly we know that when young adults are seeing this talked about, they're more likely to be able to talk about it themselves. So we can set the tone and lay the foundation, which is going to really help change the culture and empower young adults to run with it.
Yeah, I see we have a question here. So I believe, could you share the statistic in reference again? So I believe it was Albright and Schwartz, a study conducted in 2017. And the specific statistic I think that we're referring to is that 67% of students tell a friend that they're struggling with their mental health before telling anybody else.
Yep. And then the other one I referenced in there is a Rand Corporation study that was done in, I want to say 2017 also. And it suggested that where campus is perceived as supportive of mental health, students are 22% more likely to seek support when they need it.
Right. So Becky, we've kind of talked about the why, like why should we be thinking about, if this isn't something that's already established on campuses, taking a peer-to-peer approach. But can you maybe share some of the ways that institutions can foster peer-to-peer support? Like what can they do to really make this a part of the culture and their mental health initiatives?
Yeah. Well, one thing I think is really important to keep in mind, I think it's easy to feel overwhelmed by this idea. It's easy to feel like, oh, this is too expensive or it's out of reach for us or something. But I think what's really profound about this is that it doesn't have to be, certainly there are things you can purchase and policies and things. There are ways to spend money on this, but there are also ways to make very profound change without huge investment. And that's going to be things like policy change. So being open and about your policies around mental health. So that's going to be leave of absence. So supporting students and taking the time that they need to recover, the same way that if somebody got injured, they could take a semester off and it wouldn't impact their transcripts. Whereas in a lot of places right now, still, if I took a semester off because I'm having a hard time or I'm struggling and I need time to recover, that could negatively impact my transcript. And so changing policies like that and being, and talking about that, letting students know that that's a resource that's available to them. Supporting faculty in in integrating messages into their syllabi. You know, that's kind of a simple, profound shift. If every syllabus on campus had a little blurb at the end, if you're struggling, here's the support that you can seek for that. That's so valuable and important and accessible, right? And then of course there are really important ways to engage with curriculum and student groups like Active Minds, you know, organizations like Active Minds who are partnered with amazing companies like You Thrive. You know, students can do so much with so little. It's like if we have the support around it, and then even a small investment in student activism can go a really, really long way. And, you know, and I just am never not in awe of how much our student activists are doing on campuses and advocates are doing to change the culture and the conversation around mental health. So my big piece is, you know, my big suggestion is we need to be more open about it. We need to talk about it. We need to not shy away from it for, you know, out of fear that mental health is a scary thing to talk about, or out of fear that we don't have the resources to engage with this. And I hope that doesn't diminish the importance of resources. Certainly that is important. And I just want to make sure that people are not feeling like they can't do anything if resources are limited. Yeah, those are a few things.
Yeah, I think just to piggyback, like those are great suggestions off of what you're saying is, you know, for those of you perhaps who are on who are involved in orientation or perhaps with, you know, residential life, having orientation peer leaders and residential assistants make this a part of their training in terms of helping them feel comfortable with vocalizing mental health to their students when they're, you know, engaging with them, and letting them know that they're a resource that they could come to, or even not making it about mental health needing to be like there's always an issue, but even from a proactive standpoint, that's really the angle that we try to come at it, which is equipping students with skills before crisis even, you know, gets there, before they get to the point of crisis, which is, you know, raising awareness, creating knowledge that it's okay if you're going, you know, to go through some struggles. That's just a natural part of the college experience. But I think also things like, you know, having students maybe perhaps learn different techniques that they can teach to their peers in terms of really simple things that don't take expertise in psychology or in, you know, mindfulness or some of these fields, in terms of how do you kind of calm the nervous system down in a few minutes, right? And these are things that are really simple tools that can be taught by peers to their peers. So empowering, you know, through the work that you're doing with students and peer work, to make this a focal point of something that perhaps they can integrate in their normal conversations, like when they're, you know, if it's orientation, when they're talking about, you know, where you go to register for classes or where academic advisors are, it's making sure that they're talking about where the counseling department is. And then also, you know, here are some tips that you can use if you are kind of feeling stressed out. So I think those things are also really critical to taking specifically this peer-to-peer approach. Do you have anything to add to that, Becky?
Yeah. So Active Minds a couple of years ago really engaged deeply with faculty, and we said, you know, so what's going on here? What are some potential barriers in place? What do you need to support this conversation on campus? And one thing we really heard loud and clear that I think is important to acknowledge for anybody in the room who this resonates with is, you know, we saw faculty were intimidated by the idea of kind of being sort of the mental health first point of intervention or something like that. Like it felt too big. And then that's of course on top of already very busy schedules and very busy workloads. And, you know, and I think about the pandemic, which has only exacerbated kind of all of those pieces, both workload and mental health load and all of those things. So I think, you know, we could spend a whole separate hour talking about just that, but I think my message is it's not about being at everything, or it's really important that we're not that no one takes away from this conversation, that they need to be kind of the all of it, that there are resources to support you. It's about kind of that adding a layer of the conversation and how profound it can be to just acknowledge mental health and to say, I support this. I may not be the expert in it, and that's okay. But I support this conversation, and your mental health matters, and I care about that. It's really, really powerful and profound.
Yeah. And I know something that's, pretty critical to the work that Active Minds does is really helping to provide a shared language to discuss mental health for peers. And I don't know if you want to touch a little bit on the VAR or VAR method that you guys use, because I think that's something, I don't know if we can direct folks to learning more about that, but it can empower students how to even approach a situation if somebody comes to them, a peer, and they're like, I'm struggling with my mental health, or whatever it is that they open up about.
Yeah. So VAR is Active Minds' everyday tool for everyday conversations. We call it. It's validate, appreciate, refer. And again, I could do a whole separate 90 minutes on VAR, but in the 2-minute version, what we're talking about is validating their feelings and experiences. What that looks like is, saying that makes sense, or that sounds difficult. It's appreciating that they shared. So I'm glad that you spoke up. I know it can be difficult. I'm glad you decided to share. And then referring people to skills and support. So that skills part is going to be things like healthy coping techniques and self-care and time management and all of those things. And then support, it might be social support, it might be professional support, it might be academic support, whatever that person needs in that moment. Really, VAR is about responding to people in the way that is right for them in that moment. And it doesn't have to be kind of a big mental health conversation. That's really the goal, is to make having a conversation around mental health more accessible and kind of less intimidating. We know a lot of people, they want to support people around them, but may not know what to say. And so VAR is a tool that's intended to just kind of get over that hump of like, what's the thing to say here? So you can learn more, and I'll type this into the chat, but activeminds.org/VAR. So I'll put that down. And it's been such an important tool for faculty, for staff, for students. I use it with my family, with my partner. I use it, with my kid. It's just like, it's a very, I think, amazing. And of course it was created by students for students, which is something that I think is really powerful about it.
Thanks for sharing that, Becky. Yeah, I think that's a really tangible thing that for those of you on the call that want to be able to share something, let's say if you have peer mentors or residential assistants or any other form of peers, to equip them perhaps with kind of how to ease into this kind of conversation. I think that's a really, really great tool. I see we have a question from Darlene here. Our campus administration is talking about paying graduate counseling students to provide peer-to-peer counseling support to students. What are your thoughts on that?
Quickly, I think my response is, I think it makes a lot of sense to try to be creative with resources. We know that the resources are stretched thin. That can be challenging to access. I know at the college that I worked at, we had graduate students who were doing internships, who were providing counseling services, and were really, really helpful. And so I do think that that's a potentially great avenue. We know that a bigger issue, and one that needs a lot of resources, is counseling staff, and in particular representative counseling staff. So people who are BIPOC, or Black, Indigenous, people of color, or people who are LGBTQ plus. We know that there's very serious underrepresentation in those arenas in particular. And so counseling staff is always important. And I think finding creative solutions to that makes a lot of sense.
I completely agree. I think that, is one avenue to really kind of disarm individuals who perhaps maybe are intimidated to going to counseling departments, and perhaps they would be more inclined to do so if it's, you know, more of a contemporary of theirs, they can open up. So I think that's a really great avenue to explore. And, you know, something else that I just want to circle back on is we're kind of talking about various ways that you can begin to think about taking a peer-to-peer approach is, you know, going back to this whole proactive way and embedding some of these skills and dedicating perhaps class time, or, you know, whichever department you're from, in the way that you're engaging with students, to spending some time to allow students to share, just to have an open, honest dialogue. Again, you don't need to be an expert. It's always good, we always say, to have referral resources on hand so you can direct an individual and to set certain boundaries, and making sure that, you know, some group rules are kind of shared at the forefront, but you don't need to shy away from opening up a conversation to allow students to kind of share what's going on for them this past week, even if it's just taking 5 minutes, or sharing some sort of tool that they can all practice together, that they can add to their toolbox in terms of helping them with stress management. And I think that is really the main reason that we partnered up to provide this curriculum, to create a standardized, really kind of like a manual, a how-to on having conversations, whether it's directed by a peer or directed by, oversaw by a faculty member, but to empower you to not feel like you need to be an expert in these fields, to really be able to facilitate conversations among peers, to give them a safe space, to give them a platform. So really thinking about what are the pockets on your campus, perhaps where students kind of come together, that this could be something that perhaps there's, you know, room. I know schedules are so packed and there's so many different things that need to be covered, but how can you maybe even in a really small way begin to think about integrating this and setting some time aside for students to kind of just bond and connect with each other over their mental well-being, and how to kind of be proactive about learning certain skills to kind of help them before they even perhaps need it. So I just wanted to kind of add that in there as well.
Yeah. Yeah. I just want to add one extra layer to the graduate. I was kind of thinking about it a little more. So I do think it's a really great and creative, important avenue, and will be very helpful for a lot of people. I will say, certainly in those cases, supervision is important. There will be students or situations that require kind of a higher level of professional support, and that's really important. I just wanted to kind of add that caveat. Like, certainly there will be moments that require a higher level of training and more experience to handle.
Thank you for that. So I know we're kind of nearing on our time here. I know Becky and I are so passionate, we can talk about this forever, but we do want to be respectful of everything that you all have going on. So I definitely wanted to open it up for a little bit more of a formal Q&A. If there's anything that you want us to elaborate on, or any ideas that maybe perhaps you've come up with in terms of ways you might be able to integrate some sort of peer-to-peer support on your campus, we'd love to hear from you. Give it a minute. I'll also pull up our contact information if you want to take this conversation offline. So let me just do that. Okay. Let's see here. Here is both of our contact information. Again, please don't hesitate to reach out to us. Let's see if there's anything else. I'd like to know more about supervision of the peer counselors. Do you have any thoughts on that, Becky?
Yeah, it's not quite my arena in terms of professional supervision and peer counseling, or of graduate level counseling. I know that where I worked in a counseling center at a college, I was in the health education side of things, but worked alongside these peer or graduate student counselors. We had a professional kind of licensed psychologist on staff who was their supervisor, and so those graduate students would report to them and kind of, you know, and be in constant communication in case anything came up. So yeah, not quite my arena. That's my anecdote, my personal experience with it, but and so it would have to certainly be kind of explored, I think, on an individual basis.
Yeah, I agree. Not my area as well. So I don't really have anything to add there. But if we hope that this kind of just really scratched the surface with beginning to um, start the conversation on thinking of ways that you can engage your peers and take a peer-to-peer approach with the larger mental health initiatives that your campus is implementing, thinking about implementing. Again, our contact information is up there. And if you're interested in learning more about this peer-to-peer wellness curriculum that we've co-developed, You Thrive in Active Minds, we are hosting a webinar tomorrow. You Thrive Educational Services is hosting a webinar tomorrow at 12 p.m. Eastern to share a little bit about that, and then also just to share a little bit more about our other offerings. I'll drop a link in the chat for anybody who's interested in kind of learning more. And again, please don't hesitate to reach out to us for any questions or comments. We'd love to hear from you. And thanks for joining. We hope you have a great rest of your day. Becky, you want to add anything else, or?
No, just thanks for the chat. This was lovely. I hope yeah, feel free to reach out if you have any more questions.
Wonderful. Bye, everybody. Thank you.
Bye.